I became interested in radiography through veterinary medicine, actually. I worked in vet med for several years, and we do x-rays on cats, dogs, exotic animals, and I always found it really interesting. So when I figured it was a good time for a career change, I looked into the radiography program here, thought it was really interesting. I liked it. It's like a blend of photography and arts and then science. So I decided to pursue that career and have been very happy.
I think I took a roundabout way being interested in radiography as a career. I've done the college, a bunch of them. I've had a couple different jobs throughout the years, and I had just moved back from New Jersey, and I was trying to figure out what I want to do with my life. I knew I liked healthcare. I knew nursing wasn't my cup of tea. I knew respiratory was not my cup of tea. So then I was like, well, kind of what's left? And then there was radiography, and it's like, I think I might enjoy that. And so I did some research online and learned all the kind of like the cool science behind it. That's what really kind of got me into it at first, was the science behind the x-ray and attenuation and all that good stuff. So electromagnetism, I still enjoy that to this day. And so as the program went on, I became to get more and more interested. And that's when it really connected with me, and I knew that I was kind of in the right place, because I got to do both healthcare and involved in the science part, but I still got to have that patient interaction, which I really do enjoy.
I first became interested in radiography when I was in high school, when I started to kind of look at what I wanted to do with my career, and I always loved helping people out. Had a lot of family members with different kinds of illnesses, and I was intrigued at doctor visits by like the different kinds of anatomy. So I narrowed down my search online to radiography and decided to go for it.
I've always been interested to do something in the medical field, and I heard about radiography program because I have had my arm and my legs fractured so many times when I was a kid, and going down to get an x-ray, it just seemed really cool, like a big camera. And I was debating between dental hygienist and radiography, but just looking at the camera and being like, working as a photographer, that was something that I wanted to do. So I researched about radiography, and I researched about the schools in this area as well. And that's how I came to decide that I wanted to do x-ray and be a photographer for anatomy.
So I became trained in CT and MRI the exact same way. Because I was cross-trained, I got my clinical hours and I logged all of my exams. And then I was able to do my structured education on the ASRT website, and seamlessly it went to ART, and I took the test, and here I am. Yeah, that was very fortunate for me, because honestly, I didn't have to go to school. So there are different ways to get to your goals, and that's important to do the research on that as well.
I would definitely say be thorough with your biology and anatomy. So I would suggest people who are interested in this program to do their anatomy and physiology 1 and 2. That really helps you get a head start in this program. I would also advise them to take medical terminology, because the language that is used in learning these procedures, it's really helpful if you already have a background of medical terminology. It also helps you to have some basic math like algebra, because you're going to study some physics as well, so that will help you with that. And some critical thinking, because every patient is different, so you're going to have to think outside the box in order to get your pictures. So those are the courses that I would recommend to anyone who wants to get in this program.
I have the gift for gab, and it definitely helps in my job field. Sometimes it even hurts, but I'll take it, I'd rather my patients feel comfortable in conversing with me, and even the ones that don't feel comfortable, you can kind of pick up on that and maybe dial it back a little bit. Sometimes patients aren't feeling their best and they don't really want to talk, and that's fine too. But sometimes they need that connection, especially in this time where COVID and their family is not able to be with them. Sometimes they just need that conversation for just that moment. And then, I like to think that I'm helping them heal.
As a student tech, it's really important to focus on your patient care. When we say patient care, we're talking about interacting with the patients that we see on a daily basis. It's important to focus on being kind, being gentle, making yourself clear and communicating well to people. People feel safe as long as you let them know what's going on. It's really important to do that. It's really important to focus on the safety of that person. They're in your care. You're responsible for them, so if anything happens to them, it falls upon you.
Yes, there are other opportunities to advance your education after you graduate. You can go learn in different modalities. Where I work now, I would have the opportunity, if I chose to go work in CT or MRI and learn on the job. You can go back to school and study different things like sonography. I had been interested at one point, no longer interested, but I could go back to school and learn that. Same with mammography. I actually did study that for a little while. Chose it wasn't for me, but it was nice to actually learn and see what it was all about, get hands-on experience and decide whether I wanted to pursue that or not.
Yes, fortunately for me, I did get an opportunity at Carolina East Medical Center to work as a radiologist assistant in my second semester. Not all the students get that opportunity, but I was lucky enough to get that. And the way I got it is I was just proactive in learning and asking the right questions. And I would do everything and anything that would need to be done, especially during these times of coronavirus. I would just, even though I'm still a first semester or second semester junior, I still haven't learned everything, but I would try my best to ask them or just be proactive in helping them, making the technology's day easier. And I think that's how I got the job.
So a typical day over in the cath lab, no day is really typical over there, but usually starts at 07:30. We get there, get changed, check our board, see what our cases we have, and check your room, because even when you're a student in clinic, you got to make sure the rooms are stocked, especially working where I'm at. You've definitely got to make sure you've got all your equipment. Get the room ready. That's what we do next. We have what we call a tray that we throw. It's all sterile. You have to use sterile technique and keep everything good to go. Then we go get our patients, we bring them into the room, and then we perform our exams. They can be anywhere from 20 minutes to a couple hours, depending on how complex the case is or if we run into any issues with the anatomy. Sometimes the arteries and veins are tortuous and we have to use a different route. So really that's kind of the main gist of it. You get there, you turn everything on, you get your patient, then it's just cycling through your patients just as efficiently as you can. But you do still get that patient contact, which is very important, at least for me, because I feel that I get more of a connection with my patients because I'm more directly involved in their health care. I get to actively see what's wrong with them and then be an active participant in helping them. So I feel like I get to build that rapport, and I also feel like I can comfort them when we're in there, talking them through the procedure, telling them what's going to happen, and all of that. So that's a big takeaway for me, is the fact that I'm able to help people.
So a normal day for me actually starts at night. I work as an overnight x-ray technologist. So I go in and start at 6 p.m. and I work until the next morning at 6:30 a.m. I love it. I'm a night owl, so it works out for me. But we go in and we kind of take over from day shift. So we see what's going on, what they've had throughout the day, if there's going to be any OR cases overnight that we need to be aware of. Mostly I'm in the emergency room dealing with imaging coming through there, any traumas that might come through. And sometimes we do get called upstairs to the floor if they have a stat or a rapid response or a code blue and they need a chest x-ray or something afterwards. We have OR cases occasionally, and occasionally we have some fluoroscopy cases overnight, and we have to call in our radiology assistants or even a radiologist to come in and help us. In the morning we have our morning portables, so it's like 3 or 4 in the morning we got started with those, and we go upstairs and take a whole bunch of chest x-rays. And then at that time we're just kind of slowing down, have a few 2V chest x-rays come downstairs, so we finish those up, and then we flip-flop again with day shift and let them know how the night went, anything that they need to look forward to, and go home and get some sleep.
First of all, we have 2 rooms here that have x-ray equipment. And both of the rooms have really good equipment that we can work with. As you can see, we also have a Phantom that has basically the same tissue density as of human body. So when we shoot x-rays, we practice on this Phantom. We call him Choco, which we love. And we take x-rays on him. When we go out, we take x-rays, we take the pictures. We are able to learn what we missed, how we would better the image. And we also, this semester, started doing labs, which has helped us a lot into understanding the techniques that we need to use, because every patient is different. Some patients you need to use low technique to get the best image possible. And doing that in labs and learning them in the class, it's really helpful. We also learn about different images that were taken, like some of our professors would pull it up from Google, and we would look at those images on the view box to see what exactly you're looking for. Because when you take an x-ray, you need to know your anatomy and you need to know what you're looking for. And it really helps when you're able to do the same things that you'll be doing once you have a job in x-ray. You'll be doing that in a school. So it really helps to set you up to have a great career.
One of the parts that I liked best about the program was the hands-on learning that we done in the lab. It was not very stressful like it is like in clinic. Whenever you're there, you're kind of pushing to do good, but in the lab, you can just really learn stuff and ask questions that you might be scared to ask. And the more that you practice in the lab, the better you will do in clinic and the more confident you will feel, and the better and easier the program will become.
As a student radiographer, one of my most difficult cases, probably barium enemas, which you have to learn, and you do those a lot in fluoroscopy. I worked at one of the outpatient centers, and we did barium enemas almost every day. It's very uncomfortable for the patient. You're in their personal space, and so you have to use your communication, explain exactly what you're doing for the procedure, that it's invasive, and again, they're probably going to be a little bit shy or embarrassed about it. A lot of times you're working with little old men and women, and they're on the table really cold and scared, so you're trying to comfort them throughout this really uncomfortable procedure.
Actually, this was last week, so it was a very difficult procedure just because of the situation. I've done a few x-rays on infants so far. It's usually very either chaotic or calm, one or the other, because you have, instead of just having one patient with one variable of how that person's going to feel or react, you now have two. You have a child and a mother, which can lead to things either going very well or going very poorly. I've had good experiences so far last week. Luckily, the mother was very calm, but the baby was crying pretty intensely. It's a very stressful situation. I had to step back for a second, take a breath, calm down, make sure that the baby was safe and okay and wasn't being harmed, and just relax, kind of breathe, and know that everything's going to be okay. And I ended up getting the images, everything looked good.
Students enroll each fall. We accept 20 students per cohort, and the program is a 5-semester program, so they will start in the fall, and then they will continue spring, summer, fall, and will graduate the senior spring semester. I recommend that candidates that are preparing to enroll in the program to take Anatomy and Physiology 1 and 2, a chemistry course like Chemistry 131 or higher, a physics course like Physics 110 or higher. I also recommend that they complete their English courses, their psychology courses, humanity courses. Doing that in advance will allow them to reduce their load, and it will help them be more successful in the program. There is travel involved with this program. Students will be expected to travel up to 50 miles per day, one way, when they're going to a clinical site. It will not be like that every semester, but maybe 1 or 2 semesters out of the 5 semesters of the program. A student that is looking to be enrolled in our program must be a very dedicated student. There's a lot of time commitment involved. There's study time, there's clinical time, travel time. So a student that is preparing to be in the radiography program needs to realize that there is a time commitment in this program. At the end of 5 semesters, students will be expected to sit for the American Registry of Radiologic Technologists certification exam. This is a 200-question test exam. Students, when they pass this exam, they will then be a registered radiographer. Our program is structured in that the students will be on campus for classroom, lectures, and labs. We do have 2 energized labs, so they will be doing experiments and laboratory experiments and positioning here in the lab. They also will be going to clinical, again, anywhere from 2 to 3 days a week, depending on the semester. So again, there is a very big time commitment. Trying to work while you're in this program may be very difficult because of the amount of time involved.